This topic is pancreas. Okay, so to talk about pancreas, first again we are going to deal with dissecting all the outer covering, that is superficial structures. So first we are going to dissect out external oblique, internal oblique on either side. Then we are going to remove rectus abdominis, all the other muscles, that is transverse abdominis, all those things. Then we will get into peritoneal region. So after reaching the peritoneal region, we are going to see a part, that is a white covering, which we already know we have greater omentum. So if you remove this greater omentum, we will get to see all the structures clearly. So if we are seeing these structures, here we are going to see or search for pancreas. Pancreas, you know, it is present in the upper part. Okay, so here we have 9 regions. Among 9 regions, we have got our left hypochondriac and epigastric region, which are going to have this pancreas in its position. So to see that, first we are going to remove the important organ called liver. So once you remove liver, you will get to see structures such as stomach and gallbladder. So we will remove gallbladder also. So then after, we are going to take out this transverse colon. So after this, you are just seeing the stomach with small intestine. Okay, and here whatever you are seeing is all fat structures. Okay, so now can you see some soft lobulated structure here? So this is the structure which is hired out and it is present on the concavity of duodenum. So this is stomach, right? This stomach, it is going to continue as duodenum, and that again going to continue as jejunum and ileum. So these are the jejunum and ileum part. So between the concavity of the duodenum, we have got our pancreas present. Okay, so this is pancreas. So I will show you. Wait. So this is the pancreas, highlighted region what I have shown as pancreas. Now we will just remove this jejunal and ileal part also. Now you can get to see this organ properly. So if we remove the stomach also, we can see the full part of stomach. The whole structure of pancreas will be seen properly, because this is the one among the structures of stomach bed. We have already dealt. We have pancreas is the major structure related to the postero-inferior surface of stomach. So this is the pancreas region. So it is related first to the concavity of duodenum, and then after it is going to extend leftwards to reach the spleen area. So this is the whole of pancreas. Clear? Okay. So now we are going to deal about the details of this pancreas. So first you see how it is related. So you can make out the anterior surface of pancreas. So this pancreas again we will divide into 4 parts. One is the head part, which is related to duodenum, this whole region, and then we will be having a small part we will call as constricted area. Can you make out the constricted area here? So this area will be called as neck. After that you will get the whole region. This part we will call as body of pancreas, and the part which is related to the spleen, this is spleen area. So the part which is related to spleen will be called as tail of pancreas. So altogether we have got 4 parts of the pancreas: head, neck, body and tail. Okay, now we are going to relate all those structures with the proper organs. So before going to the details, first you just orient how these organs are related. The abdominal other organs, how it is related, you just orient yourself. We are going to remove the posterior wall muscles also along with the rib. So what you are seeing here is kidney. Okay, right kidney, spleen we are removing along with suprarenal gland. So if you remove all these structures, so all these vessels also, you will get to see the organs properly. So posterior to pancreas we have got this vessels along with left kidney and spleen. You can orient know how it is present. So this is pancreas. Okay, in the posterior part you are seeing in this way. Okay, now we will get into diagrammatic representation how it is present.
So in today's topic we are going to deal about the another abdominal organ, that is pancreas. So the pancreas, in the sense, this is a soft lobulated gland which is seen in the abdomen part, and it is outside the GIT, that is gastrointestinal tract. So here we have got some general feature for pancreas, that is it is a soft lobulated, which is having many lobules in it, lobulated gland which is going to secrete both exocrine and endocrine secretion. Exocrine and endocrine parts will be seen in this pancreas. So both the parts are seen in pancreas, and it is a soft lobulated gland. To talk about the anatomical feature which we are going to see in detail, first we have to know about the extent of this pancreas. Talking about the extent, the pancreas, it is extended towards left. So from the right, it is going to extend towards the left across the posterior abdominal wall. Across the posterior abdominal wall. And it is extending from duodenum. I will show you a picture. So we have got an organ called duodenum, which is a part of gastrointestinal tract. So we have got duodenum, and this is the concavity of the duodenum, and somewhere here this is on the right side, and the left side we have got another organ called spleen. So we have got spleen on the left hand side, right side we have got duodenum, and our pancreas, which we are dealing now, is going to extend from the concavity of the duodenum to the spleen. To the hilum of the spleen it is going to extend. So this is the extent of pancreas which we are dealing now. So pancreas, it is extending from duodenum. So concavity of duodenum, lodging the head and neck, head of the pancreas, and this is the uncinate process which we will deal later. This is the body part which is going to extend till the tail of the pancreas, and the organ which is going to extend here is spleen. Till spleen we have got this whole of pancreas extending. So this is how we have got location of the pancreas. Now we will, extent of the pancreas. Now we will get to see the situation of the pancreas. So we are going to see about the situation. So talking about the situation, you know, in the abdomen we have got some 9 regions, right? So we are dividing the abdomen into 9 regions by means of 2 vertical and 2 horizontal lines, which is dividing into 9 regions. Among this we have got our duodenum somewhere here. Duodenum will be present over here, and then we have got spleen, this area. Here pancreas, it is going to occupy the epigastrium region and left hypochondriac region. So I will tell the regions first. We have got the middle region as umbilical region. Above that we have got this area as epigastrium, and this is right hypochondriac region, and this is left hypochondriac region, and this is right lumbar, and this is left lumbar. And below that we have got right iliac and left iliac, and here this is epigastrium and this is hypogastrium. So this is how we have got 9 regions in abdomen. In that, pancreas is occupying epigastrium region and the left hypochondriac region. So these are the 2 regions where we have got our pancreas situated. And now we will move on to the other features. So talking about the shape and parts of the pancreas. Next we are moving on to shape and parts of the pancreas. So we will see shape and parts of pancreas. So talking about the shape and parts of pancreas, first we will move on to shape of the pancreas. The pancreas, it is of retort flask shape. You know, we have got retort flask in such a shape where we will be having a extended area and a narrow part, and this extended bowl area is going to resemble like head of the pancreas, and this area is resembling as body of the pancreas, and this narrower part where the emerging between the bowl and narrow part we will call as neck. So in this shape it will be seen, that's why it is referred to as retort flask shape. So now we have got the shape which is of retort flask shape. So we have got somewhat like this. So like this we have got our pancreas, and this is the retort flask shape inverted type. And here the size of the pancreas, if you are seeing, we have got length, whole of the length of pancreas, that is about 12 to 15 centimeter, and talking about its breadth, it is about 3 to 4 centimeter, and thickness it will be about around 2 centimeter. The whole weight it is around 80 to 90 centimeter. Now we will see parts of the pancreas. We are going to parts of pancreas. So talking about the parts of pancreas, we have divided this pancreas into 4 parts. One is head, another one is neck, and then we have got body, and the narrowest part which is extending towards the left side we will call as tail. So this is head, neck, body and tail part of the pancreas. So this is how we are dividing the pancreas into 4 parts. Along with that you can make out a process which is extending below. So this process is called as uncinate process of pancreas. This is uncinate process of pancreas. So pancreas have got altogether 5 parts: head with uncinate process, neck, body and tail of pancreas. Now to see about the detail of all these things, we are going to see the relation for all the parts separately in detail. So we will move on to head of the pancreas first. So relation of pancreas we are going to deal first. Then we will move on to the other details such as arterial, nerve supply and all. First we will move on to head of pancreas. So head of pancreas. Talking about the head of pancreas, we have got again head. It is present in the concavity of the duodenum. As we know, we have got duodenum. We have got duodenum. In the concavity, we have got the lodgement of our head of pancreas. So we have got our head located in the concavity of the duodenum. So about this head we are going to see in detail. So talking about head, first we are going to see where it is related. So we have got vertebrae related posteriorly, such as we have got 2 vertebrae related, L1 and L2 vertebra. So at the level of L1 and L2 vertebra we have got this head of pancreas. Now we will move on to the other feature or other relation. So we are going to see relations of head of pancreas. So relation of head of pancreas, we are dividing it again into anterior and posterior relation. Anterior relation and posterior relation. So we have got our pancreas. So we are going to consider only the head part. So head of the pancreas alone I am taking. So only this part we are going to see detailedly. So head of the pancreas we are seeing. In head of pancreas, anterior to head of pancreas, we have got only 2 relations. One is we have got our transverse colon passing. So passage of transverse colon will be seen in the middle part, and then we have got some coils extending in the lower part. So we have got some coils in the lower part of anterior surface of pancreas. So these are the 2 structures related anteriorly. So first structure is transverse colon and the second structure is coils of jejunum. So these are the two structures related in the anterior aspect of head of pancreas. You have to, whenever you are reading the relation of all these structures, you have to relate or have an imaginary idea of all the organs present in the abdomen region, so that you can compare and understand in a clearer way. So this is the anterior part of head of pancreas. Now we will move on to posterior relation. So again we have got head of pancreas. So posterior to this we have got first, again we have got kidney related somewhere here. So we have got kidney over here, and from the kidney we have got a gland which is extending towards the head of pancreas posterior surface, and then we have got inferior vena cava. We have got in the posterior aspect a part of inferior vena cava present, and then we have got a diaphragm which will be seen in the upper aspect. Have got right truss developing from the vertebrae, and so right truss also will be related just behind the head of pancreas. And then we have got some vessels extending, that is we have got aorta somewhere outside, not related to the pancreas here. So this is aorta which is not related over here. From the aorta we have got some vessels extending, and those vessels are right gonadal artery and right gonadal vein which is draining into inferior vena cava also will be related. And then we have got a duct which is passing posterior to the head of pancreas, and that is bile duct. So these are the things related behind the head of pancreas. And also we have got right psoas major also will be related. A part of right psoas major muscle will also get related over here. So we have got part of right psoas major muscle. So these are the relations seen in the posterior aspect of head of pancreas. I will summarize again. We will be having first structure related as right suprarenal gland. You have to know the head of pancreas is related more towards the right side. So right side structures will be seen clearly. So here right suprarenal gland. So this is the first structure, and then we have got right crus of diaphragm, and then we have got bile duct. So second, and this is third, and then we have got inferior vena cava which is a fourth relation, and then we have got right gonadal vessels and right psoas major. So this is fifth and this is sixth. So these are the relations seen in the posterior aspect of head of pancreas. So about head of pancreas we are detailing now. Detailing seeing now head of pancreas with position and the relation anterior and posterior aspect we have seen now. Now we will move on to another process which is coming out from the head of pancreas. As I said, head of pancreas we have got one more process extending. So that is nothing but we have got So we have got our head of pancreas which is extending downwards as uncinate process. So this is the uncinate process, and in the anterior aspect of this uncinate process we have got some vessels passing. So that is the anterior relation of uncinate process. Relation of uncinate process is very important because of the passage of these two. So we have got two structures, that is vessels passing anterior to this uncinate process, and that is nothing but superior mesenteric vessels, and behind the uncinate process we have got our aorta placed. So we have got aorta placed behind. So this is aorta. So posterior relation is aorta, anterior relation to uncinate processes, superior mesenteric vessels. So this is posterior relation of head of pancreas. This is about the uncinate process. Uncinate process relation. So this is uncinate process relation, this whole part. This is anterior and posterior relations of head of pancreas. Now we will move on to neck part of the pancreas. Going to see details of neck of pancreas. So talking about the relation of neck of pancreas, we have got some important structures related, such as, it is easy to remember, neck, it is a part between the head and body. So we have got, this is pancreas, head, neck, body and tail. Now we are going to see only concentrate on neck of the pancreas, which is present between head and body of the pancreas. Now for this neck, again we have got relations such as anterior and posterior relation. Anterior and posterior relation. Talking about the neck of pancreas, only the neck part I am showing enlarged, so neck I am showing. So anterior surface of neck of pancreas, it is related to a part of stomach. So only one relation is seen in the anterior aspect, which is easy to remember. Anterior and posterior relation of neck will be having its organ starting its name from P. So you have to remember in such a way, neck of pancreas having anterior and posterior relation starting with P. Anterior relation is part of the stomach. So we have got pyloric part of stomach related over here. So pylorus of stomach. So we have got stomach, pyloric part is related to the anterior surface of neck of pancreas. This is the only relation we have got in the anterior aspect. So anterior relation and posterior relation we are seeing for neck of pancreas. Neck of pancreas. In that, anterior relation is related to pylorus of stomach. Now moving on to posterior relation. So posteriorly, again I said, we have got only one relation, that is again starting with a letter called P. So we have got a vein related just behind it, that is very important vein of abdomen, which is nothing but portal vein. So formation of portal vein is happening at this region, at the neck of pancreas. That is, we have got superior mesenteric vein, superior mesenteric vein and the splenic vein. Superior mesenteric vein and splenic vein, together it is going to form an important vein called portal vein. So formation of portal vein is happening in the posterior aspect of neck of pancreas. So this is nothing but portal vein, and this is the splenic vein, and this is superior mesenteric vein. So formation of portal vein is by splenic and superior mesenteric vein is happening behind the neck of pancreas. So this is how we have got relation of anterior and posterior aspect of neck of pancreas happening. Now we will move on to body of pancreas, how it is related to other structure. So we are going to deal about body of pancreas. So we are going to deal about body of pancreas, which is prismoid in shape. It is prismoid. If you are seeing from outside, it is prismoid in shape, and if you are having a section of it, that is, if you are taking a cross section, it is about triangular in shape. So in cross section, it is triangular in shape. So we are going to see the how it is divided and what are the surfaces and borders we are getting from this. So if you are cutting, it will be somewhat like this. I will just show you a just a imaginary picture to make you understand. So if you are taking a section, it is somewhat triangular in shape which having borders. I am showing in this picture the borders of the pancreas. So body of pancreas, we have got such type. This whole part is body of pancreas, right? So body of pancreas, to show the borders and surfaces clearly, I am showing this image. So body of pancreas, if you are seeing, we have got 3 borders placed. That is, this border which you are seeing here this is a 3D image. You have to remember, we have got anterior border, and this border we will call as posterior superior border. If you are calling that as superior also fine, and this is posterior inferior border. So these are the 3 borders we have got in body of pancreas. So these 3 borders are giving 3 surfaces. That is, between the posterior superior border and anterior border we have got a surface, and this surface is called as superior surface. So this is superior surface. Between the anterior border and posterior inferior border we have got a surface called inferior surface, and another surface somewhat here, that is between the posterior superior and posterior inferior surface we have got a surface which will be seen behind, and we are calling that surface as posterior surface. So that is called as posterior surface. So this is how we are dividing the surfaces of pancreas with 3 borders and 3 surfaces we have got. Now we will get to see the details of each surfaces separately. So talking about the surface, first we will move on to superior surface. So we are going to deal about superior surface. So in superior surface, again we have got anterior border and posterior superior border. I will show both the relation, that is superior surface relation and inferior surface relation, in one image. So superior surface and inferior surface we are going to deal, and inferior surface. In superior surface we have got our stomach related anterior anterior surface or anterosuperior surface of pancreas body is related to stomach posterior inferior surface. We have got in stomach posterior inferior surface which is related to many structures. So among that, one structure is pancreas. Stomach bed, it is related to many structures. Among that, one is body of pancreas which is getting related over here. So body of pancreas superior surface is getting related to posterior inferior surface of stomach. Posterior inferior surface of stomach is relating to the superior surface of body of pancreas. In the inferior surface, if you are seeing, we have got our duodenum coming. So this is going to extend and we will be having, it is going to hold the head of pancreas, and then the duodenum fourth part, it is going to form a flexure to continue as jejunum. So we will be having coils of jejunum coming from the extent of duodenum. So we have got duodenojejunal flexure. In the inferior surface we have got duodenojejunal flexure with coils of jejunum related to the inferior surface. Along with this we have got transverse colon also related. So we have got left colic flexure related somewhere here, or just remember we have got transverse colon related. Transverse colon related in the inferior surface. So we have got in the superior surface posterior inferior surface of stomach. In the inferior surface duodenojejunal flexure, coils of jejunum with transverse colon will be related. Now we will move on to posterior surface of the body of pancreas. Talking about the posterior surface, posterior surface posterior surface, if you are seeing, we have got pancreas body. So I am showing a rough image. So in the body of pancreas, so this is tail part, only this part is considered as body. So in body, posterior surface, we have got left kidney related. We have got left kidney related with part of left suprarenal gland, and also we have got left crus of diaphragm related. Left crus of diaphragm will be related, and then we will be having, sorry about this, we have got left psoas major muscle, and then we will be having aorta somewhere present over here. So we will be having relation of aorta also with gonadal vessels such as artery and vein. So these are the structures which are related to the posterior surface of body of pancreas. I will summarize again. We have got left kidney, left suprarenal gland, left crus of diaphragm, and aorta, and left gonadal vessels, and left psoas major muscle. So these are the structures related in the posterior aspect of body of the pancreas. So it's simple to remember. One thing is, head of the pancreas, it is related to the right side, or it is placed in the right side, and body towards the left side it is coming. So you have to know the positioning of the parts of pancreas, then it will be easy for you to remember all the relations. And once you come to know all the organs separately with the positioning, it is easy for you to remember the structures related also. Now we will move on to borders. Borders I am not going to explain detailedly. Just remember the anterior border, it is giving attachment to root of mesocolon. So root of transverse mesocolon will be attached to the anterior border, and then in the superior border of pancreas we have got an artery passing above it. We have got an artery, I will show you here. So we have got an artery passing, and that is tortuous in course, so obviously it is splenic artery. So superior border is related to splenic artery, and inferior border we have got coils of jejunum related. So these are about the details of body of pancreas we have got. Now we will move on to tail of pancreas. So we are going to see about the tail of pancreas. We have got pancreas with head, neck, body and tail. Head, neck, body and tail part. So about this tail part we are going to see now. This tail part, it is extending towards the left side, and it is going to end up in the artery, or end up in the region called spleen. So here we have got tail which is extending till the spleen. We have got spleen which is giving attachment near to the hilum of it. So here we have got spleen, and tail of spleen is getting attached to the region called hilum of spleen. So along with the pancreas we have got some ligaments also attached here, that is gastrosplenic and lienorenal ligament, which is also related to the tail of pancreas. So that also we can mention. So tail of pancreas, nothing but it is getting extended till the hilum of spleen. This is hilum, and in the hilum we have got two ligaments above and below, that is gastrosplenic ligament and lienorenal ligament. So these ligaments also will be related. Along with this we have got some splenic vessels related to the tail of pancreas. So So these all about the details of relations for each part of pancreas separately. Now we will move on to the duct system of the pancreas what we have. So talking about the ducts, which is very important for us to remember, that is again asked separately for your exams. So duct system of pancreas. Talking about the duct system of pancreas, we have got again duodenum, our pancreas with uncinate process, body and tail, which is going to extend till the spleen. So we have to extend till spleen. So this is spleen and this is duodenum, as you know already. So this is pancreas. Now we have got some type of duct arrangement. So as I said, we have got some secretions coming out from this pancreas. So those secretions are collected by means of a duct system. So we have got some mode of ducts arranged. So we have again a duct arising from the tail of pancreas and getting extended till the head of pancreas. And this duct is going to collect smaller ducts from each side. From each side of the main duct, we have got some smaller ducts arising and getting drained. So the drainage of smaller ducts are happening to the main pancreatic duct. So this is the main pancreatic duct we have got, and one separate duct will arise from the uncinate process. From the uncinate process, we have got some separate type of duct arrangement. Other ducts are happening or opening in the main pancreatic duct. So I will show you. This is the uncinate process duct which is getting opened in the upper aspect, and this is the main pancreatic duct which is opening in the lower aspect. And here this pattern of duct arrangement by smaller ducts into main pancreatic duct, we will call that type of pattern as herringbone pattern. Herringbone pattern, that is a type of fish which is having this type of bone pattern in its body. So we have got this duct which is a larger one arising from tail to the head. We are calling that as main pancreatic duct. And another duct which is arising from uncinate process, we are calling that as accessory pancreatic duct. So these are the two ducts we have got in the pancreas, and this main pancreatic duct, it is going to open in the duodenum second part with another duct which is coming from the gallbladder. So we have got another duct coming from the gallbladder and liver, and that is going to join with this main pancreatic duct, and both will unite together and form a duct called ampulla of Vater, which is going to open in major duodenal papilla. So the opening where the main pancreatic and bile duct. So this is bile duct. Both the things are opening, and that we will call as major duodenal papilla. The another one where accessory pancreatic duct opens, we will call that as minor duodenal papilla. Here we have to remember the major duodenal papilla, it will be from pylorus some 8 to 10 centimeter away. And then this minor duodenal papilla from major duodenal papilla 2 centimeter above it will be placed. So this is the actual situation of main and accessory pancreatic duct we have got. And developmental thing we will deal along with the embryology part. Now we will see only the anatomical feature of main and accessory pancreatic duct. So major duodenal papilla, it is opening both bile and main pancreatic duct together. Minor duodenal papilla, it is opening only the accessory pancreatic duct. Now we will move on to the feature of arterial, venous, nerve supply and lymphatic drainage. So we will move on to arterial supply of pancreas. Arterial and venous drainage. Arterial supply and venous drainage of pancreas. So first we will deal with arterial supply. So arterial supply we are going to see. We have got our pancreas. So here in pancreas we have got actually like all the parts as you know, head, neck, body and tail. Here we have got our duodenum which is having its concavity towards here. So here we have got our concavity of duodenum. Now we have got some type of arteries which are supplying only the head and neck, and some arteries which are supplying only the body and tail of pancreas, such as we have got gastroduodenal artery. So gastroduodenal artery, it is giving both anterior and posterior branch of superior pancreaticoduodenal artery, and same way we have got our superior mesenteric artery which is going to give a branch called inferior pancreaticoduodenal. Again it is dividing into two branches. So we have got gastroduodenal artery which is giving a branch called superior pancreaticoduodenal artery, which is giving anterior branch and posterior branch, and here also anterior and posterior branch, and this is inferior pancreaticoduodenal artery, and this is superior mesenteric artery. So these two arteries reaching the pancreaticoduodenal groove, and it is going to supply the head and neck. So it is giving some branches to the neck and some branches to the head of the pancreas. So in such a way it is going to supply. So head and neck is supplied by superior anastomosis between superior and inferior pancreaticoduodenal artery. The body and tail is supplied by, we have got our elevation, I forgot to mention. So here in the body, superior border, we have got an elevation which we will call as tuber omental. So just above the tuber omental, we have got from celiac trunk a branch arising, that is splenic artery, which is going to pass in the superior border of body of pancreas, which is going to extend till the spleen, which is dividing into many splenic branches. So this is how we have got splenic artery passing above the body of pancreas. So this is splenic artery which is giving some branches to the body and also the tail of pancreas. So body and tail will be supplied majorly by pancreatic branches arising from splenic artery, and we have got head and neck which is supplied by superior and inferior pancreaticoduodenal artery. Now we will move on to venous drainage. So we are going to see details of venous drainage. So venous drainage is nothing but we have got the important vein which is seen behind the neck of pancreas. So we have got our pancreas, and this is the neck region. In the neck we have got important vein formation, that is portal vein, right? So we have got superior mesenteric vein joining with splenic vein to form portal vein. So this is portal vein which is formed behind, and this is superior mesenteric vein, and this is splenic vein. So the drainage will happen from head and neck towards the superior mesenteric and splenic vein. It is going to drain tail and body of the pancreas, and all these things are getting drained mainly into the portal vein, and some tributaries will drain directly into portal vein also. So this is how venous drainage is happening in the pancreas, mainly by superior mesenteric and splenic at last to the portal vein. So this is the arterial and venous drainage of pancreas we have got. Now we will move on to the lymphatic drainage of pancreas. Lymphatic drainage. So lymphatic drainage of pancreas. Here we have got again head, neck, body and tail part. Here head and neck are getting drained into one area of spleen lymph nodes, and body and tail is getting drained into another area of lymph nodes. That is, we have got here spleen, we have got spleen over here, and this is duodenum. So between the duodenum and pancreas, we have got one group of lymph nodes arranged. So between the groove of pancreas and duodenum, we have got some lymph nodes arranged, and between the tail and spleen, we have got another group of lymph nodes arranged. That is, we have got pancreatico-duodenal lymph nodes and pancreatico-splenic lymph nodes. So the head region and neck region are getting drained into pancreatico-duodenal lymph nodes. The body and the tail region are getting drained into pancreatico-splenic lymph nodes. So these are the two lymph nodes we have got for the collection of lymphatics from head and neck, pancreatico-duodenal, from body and tail to the pancreatico-splenic lymph nodes. Now we will move on to the nerve supply. So about the nerve supply, I am not going to explain. So nerve supply, just you remember, we have got sympathetic and parasympathetic. For most of the organs, it is same, that sympathetic it is from the celiac and superior mesenteric plexus. Parasympathetic, it is mainly by right and left vagus nerve. So these are the features of pancreas we have got to know in detail. About the applied aspect, if you are seeing, developmentally in pancreas, we have got a condition called annular type of pancreas, that is a developmental anomaly, and the carcinoma of the pancreas usually happens in the head of pancreas. All these are the important features of pancreas we have got. So anatomical features we have dealt now detailing. Now we will see the embryology part separately later. Thank you for listening.